Did you know that an astounding 80% of people aren't brushing their teeth correctly? That's right. 4 out of every 5 individuals are missing out on optimal dental health due to incorrect brushing techniques. Now let's delve into the proper way to brush those pearly whites. Firstly, gather the right tools. Choose a toothbrush with soft bristles and a small head for better access to all areas of your mouth. Pair it with fluoride toothpaste, a powerful ally against tooth decay. Begin with wetting the brush and applying a pea-sized amount of toothpaste. Here's a friendly reminder. More toothpaste doesn't equate to cleaner teeth. Stick to the pea-sized amount. The brushing process starts at the back of your mouth, working from the gum line upwards or downwards on each tooth. Hold the brush at a 45-degree angle against your teeth. This angle allows the bristles to clean beneath the gum line, a hotspot for plaque buildup. Gently brush using short, tooth-wide strokes. There's no need for hard scrubbing. After all, it's a brushing session, not a wrestling match with your teeth. Next, shift your focus to the inner surfaces of your teeth. Many tend to neglect this area, but it's just as important. Use the tip of your brush, making several up and down strokes. Don't forget about the chewing surfaces. They're a favorite hiding spot for food particles. Tackle these areas with back and forth strokes. Finally, a quick brush on your tongue helps remove bacteria and freshen your breath. Spend 2 minutes on this routine, twice a day. That's 4 minutes daily for a lifetime of healthy smiles. To summarize, here's the correct brushing technique. Start with the right tools. Brush at a 45-degree angle. Use short, gentle strokes. Cover all areas and spend 2 minutes per session. Remember, healthy teeth aren't just about a bright smile. They're a crucial part of your overall well-being. So, give them the care they deserve. It's time to join the 20% who are brushing their teeth right. Because when it comes to your dental health, every stroke counts.